So I want to thank everyone for coming. This is an annual event that is sponsored by the Johns Hopkins Cystic Fibrosis Center to bring speakers to talk about various topics that are of interest to parents and families and patients with cystic fibrosis. We've been doing this program for a number of years. It was first started by funds from the Behrman Foundation and has been continued by funding from sponsors that are here today. So I'd like to thank them for allowing us the opportunity to bring this content to you here live, if you happen to be here to have dinner, and also through the webcast. I'm delighted to be able to introduce Lea Faraone, who's going to talk to you about her experiences with having cystic fibrosis, and I think not only be able to talk to you about what she's experienced, but also answer questions from you as well. I'm going to bring this up for you. I'm not going to give a lot of introduction because I don't want to steal her thunder.
Going to break something. All right, so my name is Lea Faraone. For those of you that don't know me, I know about half of you in this room. So I'm Lea Faraone. I'm 27 years old. I'm born and raised in Maryland. I work as an adult oncology and infusion nurse, and I have cystic fibrosis. I have been going to the CF Pediatric and Adult Center since I was first diagnosed. So I was diagnosed with CF at the age of 3, which was back in 1993. At the time, CF wasn't on our radar. No one on either side of the family had ever had CF. So growing up, I was always pretty fussy. I cried a lot. People would tell my mom that she was an awful mom and she didn't know what she was doing because I was her first kid. But she had a gut feeling something was wrong, we're going to figure out what it is. And then by the time I was 3, I ended up having a rectal prolapse. So that's when it became clear, okay, there is a larger issue at hand. She actually ended up fixing it herself. I don't know how, but she did. Congrats. So from there, my pediatrician was like, okay, let's test for CF. So that's when I took my sweat test. Obviously, it came back positive. And then my parents got the diagnosis that I had cystic fibrosis. My mom worked in the medical field, so she had some idea of what that diagnosis meant. And at the time, it wasn't a good diagnosis to have. The life expectancy at the time was only, I think, about 18. So, and there weren't a lot of treatment options because at the time, the CF Foundation and just where we are with research really wasn't there. So they decided to take it on with positivity and give me a lot of support and love, and we just always went about it that we were a team and we were going to beat this together. So to this day, that's still how we tackle it. So growing up with CF, I had a relatively normal childhood. I wouldn't say it was much different from anyone else's, other than the fact that my sister and I, our favorite game wasn't Barbies or house or school, it was playing hospital. We ran a clinic out of our playroom, and I would like to thank all of my home care nurses for giving me extra supplies so that we could insert PICC lines and IVs and do surgery. My parents thought we were totally weird. They were worried that they should be concerned, but I think it was our way of coping with CF. But other than that, relatively normal childhood. I went to school, I had tons of friends, I played sports. CF definitely played a role in my upbringing and my sister's. At the time, again, there wasn't a lot of treatments and medications, so that meant that my day-to-day routine really was just chest PT twice a day and taking enzymes before meals. We didn't have Pulmazon, Hypertonic Saline, the vest. I don't think I got my first vest until I was about 7, and it was the size of me. It was a huge metal box. You can kind of see it in that picture. That's my sister wearing it. That's the only picture I can find from childhood of someone wearing the vest. but you really couldn't bring it anywhere. It was very stationary. It didn't really allow you to do a whole lot with CF, so we've come a long way, and we've come a long way with the treatments and the medications that we do have today and have kind of slowed the progression of the disease. So then I survived my childhood, and then I entered my high school years. I went to a super Catholic all-girls school known as NDP. Some of you might know of it. They were great at accommodating CF and, making sure that I got what I needed. But high school was the time that I really realized that I was different from other people, and that other people weren't always going to accept CF, and a lot of people would end up rejecting it. During my freshman year, I was actually hospitalized, and that was my second hospitalization. And I missed about a week of school, and that was pretty standard for getting a PICC line, being in the hospital. And I came back to school, of course, with my PICC line still in my arm, obviously wrapped up so people didn't see it. And all of my friends at the time, they didn't know I had CF because I was always pretty private with it. I kept it to myself. I didn't really see a need in other people knowing about it because it was something that, my parents, they did a good job of normalizing it. And we took it on as a team. When I did treatments, they were always with me. We used it kind of as like a family time where we were all together. And I was always raised that this is what you have to do. You have to do your treatments, you have to take your medications, and there was no other option. And I just didn't feel a need from my peers that I really needed them to be a part of that. I don't know if that's good or bad, but at the time, it just wasn't really necessary to me. But at this point, I was kind of faced with this decision where, should I tell them or should I not tell them? So of course I told them. And I remember I sat them all down, and they were like, wait, you were in the hospital? And I was like, yeah. And then they're all like, why? And I'm like, well, because I have cystic fibrosis. And it was just dead silence. Of course, none of them knew what it was. So I told them what it was, and they just looked at me in pure disgust. They were so confused. They thought they were going to catch it from me. They thought I was contagious. I didn't talk to my friends for probably a month after that because they were just solely confused, I guess, and really didn't understand, but they were afraid they were going to catch it from me. So that was my first time kind of going through rejection when it came to CF. And it was very eye-opening. Of course, they all came around and they were like, sorry. But, and they've been great supporters to this day. But, it was a very eye-opening experience. So throughout high school, I required more and more IV antibiotics. I ended up being on them probably 2 to 3 times a year. We usually did it at home. I was never really in the hospital very often. And then that's when I was kind of forced with having to make a choice between continuing to get PICC lines or getting an actual port put in. And when you're, a 16-year-old girl who is already underweight, a port doesn't really sound that appealing because it's obviously going to stick out and people are going to see it and then more people are going to ask you about it. And I just wasn't in a place in life where I really wanted to explain it to people. So we ended up sitting down with the surgeon who was going to do it, and he told me, we can put it in a place that people won't see it, and it'll be something that only you know is there, no one else does. So that's essentially what he did. I went in for the procedure, had no idea when I woke up where it was going to be, but he made sure that no one could see it, and I have the same port to this day. I've had it for 10 years. Absolutely love it, would not go back. So it was definitely the right decision at the time, but I know that a lot of girls especially, they are faced with this decision of, should I really get this because it's going to change my body image. So I'm happy I got one. If anyone else is in that situation, you can always message me. So I got through high school, I got into college, graduated, went to prom, and then I was in the summer before my first year of college. And this was the summer of 2009. This incident probably happened a week or so before 4th of July. I remember I was on the phone one night, sitting in my bed, and I laid back, and I started getting this weird sensation in my chest. So I had no clue what it meant. I just sprinted to the bathroom because I knew that I was going to have to cough. So I ran to the bathroom, barely got in the bathroom, and I just started coughing up blood. I coughed up blood for a good hour. I filled up the toilet a couple of times. I mean, it was everywhere. My sister ended up waking up, and she came in and found me, and she rushed to get my parents, because at this point, I couldn't run to go get them because they were kind of far down the hall. So she went and got them, and of course, we went to Hopkins right away. And that's when my journey with hemoptysis, which is lung bleeding, started. And at that point, you know, it was the first time it happened. We didn't know why. We didn't know if it was infection related or related to something else. And they had approached me with a couple different options, but we just decided, you know, it's probably a one-time thing. Let's just see how it goes, and kind of moved on. So then I ended up starting college. I went to Mount St. Mary's University in Emmitsburg, Maryland. I stayed local so I could stay at my CF clinic. I didn't think going far away to college and having to adjust to doing everything on my own, plus adjusting to college classes and making new friends and changing my CF clinic was a good idea for me personally. And I decided to major in biology. I had a really normal college experience. I don't really think it was much different than anyone else's, other than I had to do my treatments, had to go to CF clinic, and just stay on top of my daily routine. And then the summer after my freshman year, I was actually approached by one of the doctors at Hopkins that I would be a good candidate for a research trial known as PTC 124. And I was a good candidate for it because I have one nonsense mutation that's minimal function, and then my other mutation is a delta F508. So I started that research trial the summer after my freshman year of college. And I remember my first year on it was the worst experience of my life. I felt awful all the time, and I would always tell my parents, I want to exit this study, I don't want to be in it anymore. And they're like, no, you've got to keep doing this. Essentially, it made me cough up 19 years of mucus. It was exhausting. It was pretty disgusting. I had abs after that. But, you know, it was life-changing. By the time I got to year 2 on PTC, I felt better than I ever had. It turned the mucus into water. It made my weight stabilized. I gained weight. I didn't have issues with that anymore. I had less of the hemoptysis, and I had less exacerbations. So it really allowed me to have a normal college experience. I don't think I would have had the college experience that I had if it wasn't for this medication. So around this time, I also ended up transitioning from the pediatric clinic to the adult clinic at Hopkins. And it was a pretty smooth transition for the most part, considering since I had been in this research trial, we had pediatric doctors on the team, but we also had adult doctors that would come and assess us. So Dr. Mike Boyle was one of the doctors that was actually there at the research trial that would come and assess me. And, you know, we had developed a good relationship over that year and a half. And he pretty much told me, you know, like, when you're ready to transition, I'll be your doctor. So it wasn't as scary of an experience. I did wait until I was 21. Like, they kicked me out on my very last day. Like, you have to go to the adult clinic now, which is always hard because they become like your family. And to all of them that are here tonight, I'm very grateful for everything that you've done for me. But yeah, so they kicked me out, and I was like, okay, this won't be bad. I know Dr. Boyle. But, you know, it is a transition. I can't have my parents call the clinic anymore. I had to know how to do that. I mean, that doesn't sound very hard, but when you're really sick, you get used to your parents calling. So it was just getting used to that, getting used to doing things more on my own and becoming more independent, and then building that relationship with the nurses. I mean, the nurses are your best friends. Those are your first point of contact. Those are the people that you're going to have to talk to, not necessarily the doctor right away. So just building my relationship with them, you know, that was a major part in it. But I absolutely love the adult clinic. I actually don't mind going to clinic. I like going to clinic. I like seeing everyone. But yeah, it was a good transition for the most part. So then around the same time, I decided that I didn't want to be a doctor because initially I started majoring in biology because I wanted to be a doctor, and then I realized probably don't have enough time for that considering everything I have to do to maintain CF. So I decided that I wanted to be a nurse. A lot of people can't believe that I'm a nurse and I have CF because that means I'm around germs. My answer to that is germs are everywhere, and you just have to be selective to the job that you take. But yeah, I never thought, that I couldn't be a nurse. It never even really crossed my mind. And my parents were supportive. Dr. Boyle was supportive. Everyone was on the same page. So I applied to one nursing school, and that was it. And I said, if I get in, great, I'm supposed to be a nurse. And if I don't get in, well, I'm going to do something else with my life. So I started nursing school in 2012. At this point, I had graduated with a biology degree from Mount St. Mary's, and then I went on to get my nursing degree from Johns Hopkins. Hopkins was good because they had ways of accommodating CF and being a nurse. It was probably most important when it came to my clinical rotations, because when it comes to the clinical rotations, we don't want to put me in an atmosphere where I'm going to be with a CF patient or I'm going to be with a patient that has some type of infection that I could catch. So they were very good about accommodating that and making sure I was never in a situation that was going to harm me. This is also when I think I grew as a person and really became who I am. And it's the first time that I really opened up about having CF. So in nursing school, you take this class called health assessment, and it's essentially a 7-hour class you have once a week, and you learn to assess the entire human body. You get paired with one partner the whole semester, and you're stuck with them. I had one of the 5 guys in the class, and I could have swore he was gay the whole time. Come to find out, he was not. He was married and had a kid, so that came as a shock. But yeah, so I had health assessment, and I remember one day I walked in, and I really wasn't feeling well, and we were learning about the lungs and, lung sounds and all of that fun stuff. So at this point, I definitely had an exacerbation, and I was not feeling my best. And I finally decided, look, I'm just going to open up to people about this because they can learn from me. I mean, in nursing school, every single person sounds the same. They're all normal for the most part. I mean, there are people like me that come and go. But so I was like, I'm going to open up to them and let them learn from me. So I pretty much was like, okay, everyone listen to my lungs. Like, you can hear crackles, you can hear rhonchi, you can hear wheezing, you can hear all of it that day. So everyone's listening to me. They're just like, you sound awful. You need to go to the hospital. Well, thank God I go to Johns Hopkins nursing school because the hospital was across the street. I got admitted later that night. But the whole class completely embraced it, and they are still some of my biggest supporters to this day. I keep in touch with the majority of them. They support me from all over the world. They're absolutely amazing. And they really made me feel like, they just really accepted me. And I think they are the main reason that I became comfortable talking about CF and opening up about it. So then we get to the end of my nursing school career, and I'm about to graduate. I should have had about 2 years left on PTC, but unfortunately the study abruptly ended. I'm not 100% sure why, because I was never really told, but I was just taken off of the medication without a moment's notice. And it was sad, but I didn't really understand how much it had helped me. So it was pretty evident within the first 6 months of what it had done for me, because my mucus went from being the consistency of water to the consistency of cement. I never coughed anything out. I really didn't cough much anymore because nothing would come out. And that's kind of concerning when you have CF, or at least in my opinion. I lost about 30 pounds in a month. My GI totally stopped working. My hemoptysis came back worse than ever. I, of course, filled up the toilet multiple times again with blood, so that was fun. I had more frequent exacerbations. I was in the hospital more frequently, and then I hit a point where my lung function was just shy of 20%. So that meant that you felt like you were running a marathon sitting still. It was not a pretty time in my life, and it's obviously a time I would never want to relive again. I lost a good amount of my friends during that period of time. I lost my boyfriend at the time, and it was all because they really just couldn't handle what I was going through. It was too hard for them to witness me going through this. So if you can imagine going through all of that physically and then emotionally having to go through just as much. It was a very difficult time, and I wasn't as positive as I normally am, solely because of that. So then we kind of got to this point where I was starting to get a little bit better, but I still really wasn't there, and that's when CF Clinic decided to bring up lung transplant and the possibility of that. And I know this sounds weird, but being a CF patient, I had never thought about a lung transplant. It was never on my radar. I never thought it would be me. I had always been relatively healthy, so the idea of getting a lung transplant at 24 was just, it was totally abnormal to me. So when they brought it up at CF Clinic, you know, my mom thankfully was with me. We both cried, obviously, a lot. And it was probably the only time I've ever cried at a doctor's appointment. And, you know, from there, I felt like the next 2 months, I was just a totally different person. I mean, I wasn't positive anymore. I kind of shut myself off from people. My friends that I had left really didn't understand what I was going through. And that made it hard because then I felt like I really didn't have anyone in my life that knew how I felt. Like, my family could somewhat relate, but they couldn't fully relate, and my friends really couldn't either. So the way I kind of describe it to people is it kind of feels like you're breaking up with the love of your life. So I think a lot of people know what it feels like to put a lot of time, effort, and energy into another person, and you can love that person, and you can, you know, do everything possible to maintain that relationship, but the other person just decides, look, I don't want you. That's kind of what it feels like to be told you need a lung transplant, because I had put, you know, 4 hours a day into doing my breathing treatments. I take over 60 pills a day. I do every single thing I possibly can to stay healthy and maintain the lungs that I have, and I had failed. You know, my lungs were just rejecting me. So it was a pretty devastating time in my life, and, you know, it was very eye-opening. So that is when I decided I need friends with cystic fibrosis, because I didn't have any. And that's when I started making connections on social media with other people with CF. My best friend now, her name is Tiffany Rich. She also has CF, and she underwent a double lung transplant about 1.5 years ago. So she actually has a YouTube channel, and I had seen one of her videos on finding out that she actually needed a double lung transplant. And when I saw the video, I had actually watched it about 2 or 3 days before I went to clinic and found out, look, this might be your best option. So in a way, it kind of prepared me for that, but I still didn't think, you know, that would be me. So I had actually reached out to her and told her, you know, your YouTube video really helped me. And we had already been friends, you know, we would talk back and forth, but this is kind of when our relationship really developed. And she really got me in a good place mentally. I didn't really feel like I was alone anymore. And then finally someone knew how I felt. And to this day, I think that every person with CF needs one other person in their life that has CF, that understands what you're going through, because your family can only get it so much, your friends can only get it so much, your significant other can only get it so much. So she's been a really big blessing in my life in terms of really understanding what you go through with CF. And I have so many CF friends to this day. I can't even list all of them, but they have really changed my life for the better. So in order to not get a lung transplant, I came out of my depressed 2-month time period. I was friends with Tiffany. We got me in a good place mentally. And I was like, all right, I'm not ready for a lung transplant. I'm 24 years old. I want to be older when I have to go through this. Hopefully I never have to, but if I do. So this is when I kind of came up with a strategic plan of how to get back to that. So just shortly before they brought up transplant, I had actually gotten back in the PTC 124 trial. It's also called Atlerin. But they didn't offer it at Hopkins anymore, so that meant that I had to travel to Boston Children's. So I started back on that medication, and of course, it makes you sicker before it makes you better. So that really wasn't helping when they decided you need new lungs. But so we would travel to Boston pretty frequently to get the medication, and the team up there was amazing. I absolutely love them. They have been a huge support in my life, so I'm very grateful for them. But we got me back on the medication, and a lot of the issue is when you go back on these medications that are making this mucus come up, it's also bringing up old infection at the same time. So when I was coughing all this mucus out, yeah, that's great, but it's also giving me fevers and body chills and all of those types of things because it's bringing up old infection that's just been sitting there. So we had to figure out a way to allow me to do IV antibiotics but not have to come off the medication. So Dr. Boyle and I came up with a plan for that and finally got everything working where I didn't have to come off the medication while I was doing IVs, because that was a huge issue for a while. I'd have to go on IV antibiotics, come off the medication, then restart it, and it just made the process so much longer. So we found meds that were compatible with it, and I traveled to Boston for about 3 years for this. So it was definitely a game changer again in my health. Second, I started physical therapy. I never had thought about doing physical therapy before. It had never been on my radar, and I don't think it's emphasized enough in the CF community how crucial it is to get people involved in this. I was having a lot of upper back pain solely when I would go to work or when I would just go do a daily activity. And I really didn't want to take pain meds because who wants to take more pills when you're already taking 60 of them in the day? So, I had expressed that this pain was kind of debilitating. What can I do? And that's when PT was suggested to me, that it was probably due to my breathing mechanics, and that if we were to alter that and strengthen my muscles, then, that would get rid of the pain. So I was like, all right, let's give it a try. So that's when I started PT with Karen, she's over here. And I have been seeing her for the past 2 years now. And it has been a complete game changer in my life. I can't even express how grateful I am for her, but also just what it's done for me. When I went to PT, we figured out that yes, the pain I was having in my back was related to my breathing mechanics. So that meant that I was breathing just from my accessory muscles in my neck and in my upper body. I really wasn't breathing from my diaphragm like what you're supposed to do. So I would say the first couple of months, it was just Karen retraining me how to breathe and really strengthening my core, because that's pretty crucial to that. So we, retrained me how to breathe properly, and then strengthened my muscles, and then really went about, once I got rid of that upper back pain, just really pushing me to, build more muscle and flexibility and stamina. So then it went from, laying there on the table, learning how to breathe, to, running the stairs and doing the anti-gravity treadmill and stretching. Stretching is a complete game changer also. I'm not sure why people aren't teaching people with CF just to stretch every day. The amount of mucus you can get out from that is insane. No, it's great. So these are pictures from when I first started physical therapy. So the pictures with me wearing the green shirt, or I guess the blue, it's like a teal. That's my first probably 1 or 2 visits. And at this point, I was having a lot of pain. I wasn't breathing properly. I was having a lot of lung exacerbations and a ton of hemoptysis. And I really wasn't getting any flexibility. Like the pictures at the top where I'm bending to the sides, that's as far as I could move because of how tight everything was. And then the picture right next to it is pictures from a year later and just how much of a difference it made. So I think the pictures really speak volumes for just how much PT helped. But I think we need to push PT a little bit more in the CF community. So then my next thing that I did to help me avoid transplant was get another bronchial artery pulmonary embolization. So an embolization is essentially when they go in an artery and they go up to your lungs and they insert these little beads, and it essentially blocks off the area that is going to cause bleeding in your lungs. So at this point, I had had about 6 or 7 of those procedures, which is kind of abnormal in the CF community. Normally people have about 1 or 2 from people that I've talked to. That's about what I've seen. So what we had figured out was that I had developed hemoptysis, not necessarily based on infection, but based on the fact that it was positional. So if I laid on my back, I would always cough up blood. If I laid on my right side, I always coughed up blood. There was rarely ever a time that I didn't. It only really got worse if an infection was going on, and then it would get out of control, and we'd have to do an embolization. So after you have about 7 of them, this was probably the main concern as to why transplant was the best option, because if you've had 7 of these and they haven't worked, why are we continuing to just do them over and over and over again when they might last a month, they might last a year? So this is kind of when I begged Dr. Boyle to let me try another one, and he was like, okay, sure, whatever. So, so I had the same surgeon that did them. He probably did the past 5, I would say. And, you know, we scheduled our normal appointment with him. And this time I asked, you know, can I meet with him before? Can I sit down and talk to him? Because I want him to know what I'm feeling when I get the hemoptysis, and that'll kind of help him better target where it is. So all the nurses were like, of course, we'll make sure that you have time with him, whatever. So the day of the procedure, we get there. Of course, my mom's with me. So we're sitting there waiting for him, and they get me ready to just take me back into IR. And I'm like, no, I'm not ready, and I still haven't talked to him. And they're like, well, he's ready for you. And I'm like, well, no, he has to come out here, and I have to talk to him. And of course, they're all irritated with me, and they were like, you know, you're wasting our time here. And I'm like, no, I need to talk to him. So he degowns and everything and comes out. And I'm like, you know, this is a situation I have going on. It really comes down to this, because I have so much just blood sitting in my lungs that my lung function can't go up, you know? So I tell him all my symptoms and when the bleeding starts happening, and something clicked in his mind. Like, you could just see something click. And he was like, okay. So we went in, we did the procedure. He stayed in as long as he had to until he figured it out, because he knew that my fate was getting listed for a double lung transplant if he couldn't figure this out. So thankfully he did. My anatomy is weird, and apparently majority of my blood that supplies my right lung all comes from my arm. So it just pumps tons and tons of blood from that area, and whenever I overuse this arm or lay on it, it causes hemoptysis. So he ended up fixing that problem, and I have to go in occasionally for tune-ups for it, but just the fact that we know why it's happening it's a big relief. And he was extremely happy. He ended up crying and screaming when he figured it out. So we were all very happy, probably because he didn't have to see me as much anymore. So my last thing that I think was a really big game changer in my life as well was that I realized that you are your biggest advocate. I think a lot of people don't realize that, yes, you're an advocate when it comes to, you know, your medications and your doctor's appointments and all of those types of visits, but you're also an advocate when it comes to raising money for a cure, spreading awareness. I don't think a lot of people realize how important that is to get the word out and really, you know, aspire to get to this cure, because it is attainable with where the research is going at this point. So that's when I got more involved with the Cystic Fibrosis Foundation. At this point, I was very transparent about my CF. I really didn't care if I got rejected anymore, because I had gotten rejected enough that it didn't matter anymore. So I got more involved with them. I got more involved with Great Strides. I ended up becoming a co-chair for the Baltimore Walk. And then I ended up starting something called Salty Sisters with my best friend Tiffany. We started that in, I think, 2016. And that was pretty much just an awareness platform to raise awareness for cystic fibrosis, but also for just chronic disease in general, and give people a place that do have chronic diseases to make connections with one another, so that they're not feeling like they're alone going through the process, like what both of us had felt throughout our lives. And then finally, Tiff and I got approached about a year ago to do a podcast with Gunnar Esiason. We had been friends with him for a little while, and it was never on our radar to really collaborate with him, but he came across this idea that we should start a podcast. Since the three of us combined, we've pretty much been through everything you can go through with CF. So our podcast is called Breathe In, a Cystic Fibrosis podcast. If you don't listen, you should go look for it. It's on iTunes, SoundCloud, YouTube, GunnarEsiason.com. He would tell you to subscribe, rate, and review. We need the reviews. But we have a lot of fun doing it, and it really brings awareness to what people go through with CF. And we talk about all different topics. Usually they're based on messages that we get from different parents or people with CF. So to end, what I learned was that my struggle ended up leading to the most positive years of my life. It really shaped me into the person that I am. It made me a more positive person. It gave me a better outlook on life. It taught me that what I believed was my biggest flaw in life is actually one of my biggest superpowers. I just was always kind of embarrassed about having CF, but then I realized you can make such a big difference when you just embrace it. It shaped me into who I am. I learned that positivity, faith, trusting your gut, and advocating for yourself can get you through anything in life. It taught me the difference between needs in life and wants in life. It taught me patience and balance. It also taught me that I have the best support system when it comes to my family. My mom, she goes to pretty much every visit with me, so I never have to go through anything alone. And my dad and sister are a great support as well. It's given me absolutely beautiful friendships that would never let me miss out on any type of event in life solely because of CF. It's kind of funny. I've been on a bunch of trips with a lot of my friends, and we went to Tennessee probably 2 years ago, and we decided that we were going to go to the Great Smoky Mountains and have a great time there, but I never think of altitude or how that's going to affect me. So of course we're getting to the top, and I'm about to pass out, and they just throw me on their back, and carry me the rest of the way. And they're just amazing friends, and I'm so grateful for them. It also gave me an amazing boyfriend. He loves me on my good days, but loves me even more on my bad ones, and he's embraced CF completely and has taken on my positive outlook on it, so thanks for that. And I've heard from a lot of parents, at least, that that's one of their biggest worries in life, that their child won't find someone who embraces CF, and I think that those people exist and they're out there, but it just takes a special person to choose CF. I didn't get to choose it, but the people in my life, they obviously choose CF. And everyone's going to struggle at some point in life. Mine just came a little bit earlier, but it's taught me a lot. I've learned how to embrace it, accept it, take it on with positivity. And as long as you take on anything with positivity, you can get through anything. So thank you all for being here tonight, and thank you all for listening at home. So I think we have time for questions, maybe? Okay. Does anyone have any questions?
I do.
Okay.
Yeah, so I don't want to put your boyfriend on the spot too much.
That's cool. I'm sorry.
So two of my kids who have CF, they're about to be 18, about to be 16. So I'm assuming within 10 years that you'll be thinking about getting married and significant other, et cetera. What sort of conversations have you had, or would you like to have, about the future and the impacts of CF and all of that?
So Oh, okay. It was a long question. I don't even know how to summarize that. All right, so I think the question basically was that for people that, younger people with CF, when they're approaching relationships and being with a significant other, how do you go about talking about the pretty real topics that come to CF? And just the progression of the disease and what your future kind of holds. I think it's a gradual process. I don't think it's something that you just lay out on the table on your first date. He actually knew I had CF before he met me. I didn't learn that until about probably 2 months ago when he was on the podcast and told me that, I need to tell you this before we film this. But he knew I had CF before I started dating him, before I met him. And I think it's just been a gradual process, As little things come up, he learns more and more about the disease. And as we grow in our relationship, we talk about, the bigger topics. But I don't think you should just lay it all out there right off the bat, because that's a little much to take in, I think, right away. So, and I think that's worked well for us, right? Yeah, he says yes, so. Mm-hmm. Yeah, so right now I'm just shy of 40%, which still shocks people, but it's livable. You know what I mean? I can still do everything that I want to do in life, and I think you kind of adapt to it in a sense. I'm hoping that with these next research medications that are coming out, like the triple combo, that'll give me the little boost that I need to get past that. But, it's definitely doubled my lung function, so it's better than 19%. Because I'm able to work, I'm able to live my life, so I'm very grateful for where it's taken me. Oh yeah, I'm still working. I worked through majority of this. Yes.
Yeah, just one more. So looking back, is there anything you would have done differently?
All right, so the question is, sorry I didn't repeat it for the last question because I forgot. Looking back, would I have done anything differently? I don't think that I would have, because I was a kid that always did every single thing I was supposed to when it came to my treatments and medications. I really didn't miss them. I mean, I think I've missed probably 2 or 3 times in my life, so I don't think there's really anything I could have done, and I'm pretty confident in that. So, yeah. Oh, yes.
Do you still have hard days, and if you do, how do you get through them, because you are pretty positive?
So the question is, do I still have hard days, and if I do, how do I get through them? Yes, I still have hard days. They come and go. When I have a hard day, if I'm working, I obviously kind of just take my time. Thankfully, all of the nurses that I do work with, they all know I have CF. They know my situation, and they can honestly tell when I walk in the door if I'm having a bad day. So that's when they kind of jump in and they help me out a little bit more, and I'm very grateful that I do have the team of nurses that I have. But I think I learned through this whole process that if you don't have positivity, you won't make it through some of these events that you're going to be faced with. And positivity really does make a difference. I didn't see a change in my health until I decided, okay, I'm going to be positive about this, and kind of just send those positive vibes out, because they do make a difference. So I kind of keep that in the back of my head. Yes, I cry. Yes, I get frustrated. But everyone's entitled and allowed to do that from time to time. So.
Lea, one of the questions we get a lot is, how do you think about transitioning to the adult clinic? And it's a scary moment for parents.
I mean, obviously, all right, so what do I think about transitioning to the adult clinic?
What advice would you give?
Just to be open-minded. That would be my biggest piece of advice. I think I had gotten so used to the pediatric clinic, and I never thought, oh, I'm gonna build relationships like that again. And with time, you do build these relationships, and they do become your second family. But yeah, I think you just have to have an open mind and stay positive about the situation, and just take it on.
Are you going to offer your contact information for my pediatric girls that want to talk to you?
Yes, I will give you my contact information.
Do you have any time?
Yeah, I don't have a lot of time.
Oh, about anything.
Yeah.
About life.
Yeah. No, anyone can reach out to me that needs to talk or has any specific question. So I get a lot of that right now. Yes.
Lea, do you think
helpful to you, and maybe meeting some of that staff ahead of time?
So the question is, I think that in the transition between peds and adult clinic, if meeting the doctors ahead of time really helped in the transition, and I think 100%. I think if I didn't have a relationship with Dr. Boyle before I transitioned, it wouldn't have been as easy, and I probably would have been more afraid than I already was. So I think definitely if you can build a relationship with a doctor, at least meet them once or twice and know kind of who you're going to beforehand, I think that makes a big difference. Any more questions? Okay, Josie. Hi.
Do you have advice to the parents of transitioning patients from peds to adult?
So the question is, do I have advice for parents that are going through this transition process between peds and adults? I think that it's hard for a lot of parents with CF to let go that are very supportive and involved from the start. So I think it's a gradual process as well. I think you don't go from pediatric clinic to going to adult clinic, and the second you transition, your parents are just not involved, because that's not gonna work. You're not gonna be successful. I think that it's a gradual process, and 1 week you might work on, I don't know, the kid with CF, getting their prescriptions filled, and then they become successful with that. And then the next piece is, okay, you have to call clinic now, so you get successful with that, and it's just kind of baby steps. I think when you go about it that way, you're gonna be more successful, and it's not gonna be as scary. I think if you just go cold turkey, I wouldn't really recommend that, so.
Yeah.
Yes,
I'll stand up so you can hear me.
okay.
How does your CF affect, if at all, the way you set life goals and maybe timelines?
So the question is, how does CF affect setting life goals and timelines? So I was actually talking about this the other day, and when I was younger, I was very future focused, okay? So my goals were solely, okay, I'm gonna go to college, I'm gonna do this, I'm gonna do this, I'm gonna be a nurse. You know what I mean? Like very, very future focused, 5 years down the line type goals. When I went through this whole process of, having a low lung function, possibly needing a transplant, I had to change how I viewed life goals in order to gain positivity and be accepting of my disease and where I was in life. So I would say now I kind of live day by day. I still have goals and I still have things I want to achieve in life, but I've realized that you're happier and you're positive if you focus more on the day-to-day and not such large goals like 5 years down the line. Because regardless of if you have CF or not, most people, their lives are not going to go the way they think they're going to go, It doesn't matter if you have CF or, if you do. I mean, it's just not necessarily going to go the way that you think it's going to go. So you can't really get let down if it doesn't turn out that way. So I think that's how I gained a lot of positivity, was just changing my mindset and how I looked at life. And that made a huge difference for me. I don't know if it's for everyone, but it works for me, so. Yes.
Do you have any tips on how you keep yourself organized to get everything done in a day?
All right, so the next question is, how do I keep myself organized, and do I have any tips for all of you? So, I do a lot in a day. I usually feel overwhelmed with how much I have going on. I usually do 2 hours of treatments in the morning. I go to work. I'm only supposed to work between 6 and 8 hours a day. Lately, I've been working like 12 hours, which is not good, and I don't recommend that if you have CF. And then I have to come home, get all my treatments ready, do my 2 hours of treatments again, and just make sure I'm kind of prepared for the week. One of my biggest suggestions is have a pill box. I never had a pill box until a year ago. I don't know why, I just never did. And I tell all my patients, you should use this pill box, you should use it to organize your medications, and I've never used one. So I took one home one day, and I'm like, I'm gonna try this out. And I think it is the best way to organize your meds because, you don't have to think throughout the week, it's all there. I'm very regimented and I take my morning meds at this time, get them done. I have my middle of the day meds, which I'll usually take out when I take the morning meds, put them in a baggie, and they go in my scrub pocket. And then, you know, when I eat lunch or make time to eat a snack, I'll take that. And then same with at night. But when you lay out those pills for the week, you also see what pills, you know, you're missing or what you're going to need for the following week. So that kind of gets you on track of, all right, I need to refill this. I need to get this before, you know, next week. So I think that's a big help. I also think having some type of planner or calendar really helps. I know a lot of people use their phone for this, but I'm really old school. I have a planner. I write down all my appointments in it. I write down my work schedule in it. I write down when I start a medication, when I come off of a medication. Same with like IV antibiotics and stuff like that. That way I know what my routine is. I also have a calendar that I simply just track medications because my regimen for the different antibiotics that I'm on is very different than most people. I don't do a full month on something like Toby and then a full month off. You know, a lot of my meds, it's like I'm on it for 10 days and then I switch to this for 2 weeks and then I switch to this for a month. So that was pretty confusing when I, you know, transitioned to doing medications that way. And it works great for me, but I realized you definitely need a calendar and a planner to stay on top of all of these things when it gets a little more complicated. So I think those are my two best pieces of advice. I also have a lot of alarms on my phone that remind me when to take certain things. And I think they bother my boyfriend, but that's okay. Yes?
So you have 2 hours of treatment in the morning and evening. What is your treatment routine? Like, what is it that you do for 2 hours?
Okay, so question is, what is my treatment routine in the morning and at night? So normally in the morning, I don't believe in doing the inhaled nebs on my vest. I think it's kind of doing a disservice to yourself. That's just my personal opinion. I know it saves people time. So normally I do Xopenex, which is similar to albuterol, but it doesn't affect your heart. It doesn't give you that fast heart rate. So I do Xopenex, and then I would do, most people do hypertonic saline. It causes hemoptysis for me, so I actually inhale sterile water. And that's it, but it helps loosen it a little bit. So I do that, and then I do Pulmazan, like majority of CF patients. Then I do 30 minutes on the vest, and then when I come off the vest, I try not to cough on. I try to let it just loosen everything. And then I do the acapella, or I do some type of stretching to then actively get the mucus out. And that can take a lot of time because, you know, that's the most important part. And then I'm usually on 2 inhaled antibiotics. So then once I get all the mucus out and I'm done coughing, I'll follow that up with the 2 different antibiotics that I have to inhale. And those usually take a pretty good amount of time because not all of them go into these faster nebulizers, like what a lot of people are used to using. So it's a little busy, but it works. Okay. Yeah.
Well, that was fabulous.
Thank you.
I want to thank Lea for sharing her experiences, and it has been, I think, very enlightening for us as staff and also, I'm sure, for the parents and family members. If you have questions that you'd like to send on to Lea or get her contact or get in contact with her, you can send an email to hopkinscf@jhmi.edu or tweet us, I guess, or put something on Facebook and we'll relay the information to her. Thank you very much for joining us. The webcast will be recorded and will be up on the website probably the beginning of next week. Thank you again for tuning in or coming tonight.